Hi, everyone. My name is Lilangi Ediriwickrema. I'm an oculofacial surgeon and a neuro-ophthalmologist here at the UCI Gavin Herbert Eye Institute in CTVR. I have the privilege of taking care of multiple different types of patients, ranging from patients who have eyelid malpositions, droopy lids, cutaneous malignancies, to orbital masses and inflammation and tear duct issues. I also manage patients who have problems with vision, whether it's decreased optic nerve function or double vision. In addition to my clinical practice, I work at the Beckman Laser Institute through the CTVR, whereby we are using spatial frequency domain imaging to characterize reflectance and absorptive properties in the preocular cutaneous region. And by doing that, we can monitor diseases, particularly such as that of thyroid eye disease and skin malignancies, and evaluate natural disease evolution and hopefully response to treatment. So patients in particular with thyroid eye disease can have inflammation and engorgement in and around their eye. This can lead to double vision, cosmetic disfigurement, proptosis, which is bulgy eyes, and rarely vision loss. It can, as you can imagine, be very impactful in quality of living. And so while the standard of care rests in the realm of immuno or targeted therapy as well as surgery, we're hoping that we can have cutaneous biomarkers that guide diagnosis as well as treatment. And so by looking at the way light, and these are multiple different wavelengths of light over multiple evenly spaced spatial frequencies, how this the optics of our apparatus is reflected and absorbed in our patients, we can then extract data on vascularity. What is the oxygenation? What is the hemoglobin concentration, the deoxyhemoglobin concentration? How is the tissue being remodeled? And from that, we can really hopefully start mapping out the evolution of the disease and again, really guide our clinicians and assist them in determining which is the best therapeutic option for them and how often to intervene and when to intervene. So in medical school, you learn sort of your textbook approach to patients with different diseases. And when you're a physician, you're in that one-on-one interaction in the clinic room, and it really helps to guide treatment in really a customized, patient-centered way. And our hope is this research and research done at the CTBR will really help nuanced intervention in that care of patients. And so our goal is that we have a device ultimately in the clinic that is accessible, that gives real-time data that will guide our physicians and our care provider team to deliver that impactful care to our patients who really truly feel vulnerable in the morbidity that is associated with many diseases that affect the orbit. So I would say overall, it's been just phenomenal working here at UCI through the CTBR at Gavin Herbert, and the cross-pollination of ideas, how quick and easy it is to collaborate across the multiple institutes. It's such a privilege, and I look forward to all the things that will come in the decades.